Your body may whisper before it screams. That dull pain in your upper belly, that ache in the middle of your back, that sudden weight loss everyone keeps calling normal aging, that yellow color in your eyes, that strange change in your stool, that new diabetes diagnosis after 60, even though nothing in your life has changed. Most people think pancreatic cancer begins with severe pain, but here is the frightening truth. Pancreatic cancer often begins quietly. Sometimes the first symptoms look like acidity, indigestion, aging, back strain, poor appetite, or diabetes. And that is why so many people miss it. I'm Dr. Emily William, and today I'm going to walk you through the pancreatic cancer symptoms seniors should never ignore. Not to create fear, but to create awareness. Because with pancreatic cancer, time matters. The earlier a serious symptom is checked, the more options a patient may have. Stay with me until the end, because the final warning sign is one that many seniors and even families overlook. It may appear as a blood sugar problem, but sometimes it can be a signal from the pancreas itself. Before we begin, this video is for education only. It is not a diagnosis. If you have jaundice, unexplained weight loss, persistent abdominal or back pain, pale, oily stools, or new diabetes with weight loss, please speak with a qualified doctor. Now let's begin. Number 1. Yellow eyes or yellow skin. The first warning sign is jaundice. This means the skin or the white part of the eyes becomes yellow. Many people think jaundice only comes from liver disease, but pancreatic cancer can also cause jaundice, especially when a tumor blocks the bile duct. Your bile duct is like a drainage pipe. It carries bile from the liver and gallbladder into the intestine. But the head of the pancreas sits very close to this pipe. If a tumor grows there, it can squeeze the duct shut. When bile cannot drain properly, bilirubin builds up in the blood. That is when the eyes turn yellow, the skin may turn yellow, urine becomes dark, and stool may become pale. This is not a symptom to watch for weeks. If your eyes look yellow, your urine becomes tea-colored, or your stool becomes pale, call your doctor quickly. Jaundice does not always mean cancer. It can happen from gallstones, hepatitis, liver problems, or medication issues, but it always deserves medical attention. Number 2. Dark urine and pale stool. The second warning sign is a change in urine and stool color. This one is easy to miss because many people do not look closely. Dark urine may look like cola or strong tea. Pale stool may look gray, clay-colored, or unusually light. Sometimes the stool may float, look greasy, smell worse than usual, or be difficult to flush. Why does this happen? The pancreas helps with digestion, especially fat digestion. If pancreatic cancer blocks bile flow or affects digestive enzymes, fat may not be digested properly. Think of digestion like a washing machine. If the detergent and drainage are not working, the clothes do not come out clean. In your body, bile and pancreatic enzymes help break down food. If that system is blocked, your stool can change. If pale stool, oily stool, dark urine, or yellow eyes appear together, do not ignore it. That combination needs medical evaluation. Number 3. Pain in the upper belly or middle back. The third warning sign is persistent pain in the upper abdomen or back. Pancreatic cancer pain often begins as a dull ache. It may sit deep in the upper belly just below the ribs. It may travel through to the back. Some people describe it as a band-like pain. Others say it feels like a deep pressure. Here is what makes it suspicious. It keeps coming back. It lasts for weeks. It gets worse after eating. It wakes you at night. It spreads to the back. It does not improve with normal acidity treatment. It comes with weight loss or appetite loss. Many seniors blame this pain on gas, arthritis, posture, or age. And yes, those things can cause pain. But persistent upper abdominal pain with unexplained weight loss should never be dismissed. The pancreas sits deep in the abdomen, close to nerves and major blood vessels. When a tumor irritates those areas, the pain can travel to the back. If a new back pain feels different from your usual back pain, especially with digestive symptoms, get it checked. Number 4. Unexplained weight loss. The fourth warning sign is unexplained weight loss. Many seniors lose weight because of dental problems, loneliness, reduced appetite, medications, depression, thyroid disease, or other illnesses. But unexplained weight loss can also be a warning sign of pancreatic cancer. Pancreatic cancer can affect appetite, digestion, metabolism, and inflammation. The body may burn energy differently. Food may not be absorbed properly. A person may feel full quickly and eat less without realizing it. Here is the rule. If you lose weight without trying, do not celebrate too quickly. If your clothes become loose, your face looks thinner, your appetite drops, or family members notice weight loss, write it down and tell your doctor. Weight loss plus jaundice, back pain, oily stool, or new diabetes is especially important. Your scale can sometimes speak before pain does. Number 5. Loss of appetite and feeling full quickly. The fifth symptom is appetite change. A senior may say, "I'm just not hungry. I feel full after a few bites. Food doesn't appeal to me. I feel uncomfortable after meals. I used to enjoy food, but now I don't." This may look small, but it matters. The pancreas is involved in digestion. A tumor can also press on nearby organs, including the stomach or small intestine. This can make food feel heavy, slow, or uncomfortable. Some people develop nausea after eating. Others feel bloated. Others develop a strange dislike for foods they used to enjoy. Loss of appetite by itself does not mean cancer. But appetite loss with weight loss, upper belly pain, back pain, stool changes, or jaundice should be checked. Do not let anyone say, "You are just getting older," without asking why. Number 6. Nausea, vomiting, or persistent indigestion. The sixth warning sign is ongoing nausea or indigestion. Pancreatic cancer symptoms can mimic common stomach problems: acidity, gas, bloating, nausea, burping, feeling heavy after meals, mild stomach discomfort. This is why pancreatic cancer is sometimes missed early. The symptoms look ordinary. But ordinary symptoms become concerning when they are persistent, worsening, unexplained, or combined with weight loss. If indigestion does not improve with usual treatment, if nausea keeps returning, or if vomiting starts without a clear reason, speak with a doctor. Think of it like a smoke alarm. One beep may be nothing, but if it keeps beeping every day, you check the house. Number 7. Oily, floating, or foul-smelling stool. The seventh warning sign is stool that looks oily, floats, or smells unusually strong. This can happen when the pancreas is not releasing enough digestive enzymes. Those enzymes help break down fat. Without them, fat passes through the stool. The stool may become greasy, floating, pale, bulky, hard to flush, very foul-smelling. This is not a symptom most people want to talk about, but it is important. Doctors are not embarrassed by stool symptoms. They are clues. If stool changes continue for more than a couple of weeks, especially with weight loss or belly pain, get evaluated. Your bathroom habits can reveal what your digestive organs are struggling to do. Number 8. New diabetes, after 50 or 60. Now we reach one of the most overlooked warning signs: new onset diabetes later in life. The pancreas makes insulin, the hormone that helps control blood sugar. If something affects the pancreas, blood sugar can change. Many people develop type 2 diabetes with age, weight gain, family history, or insulin resistance. So diabetes does not automatically mean pancreatic cancer. But doctors become more concerned when diabetes appears suddenly after age 50 or 60, especially if the person is losing weight instead of gaining weight. Watch for new diabetes without clear reason, blood sugar suddenly becoming harder to control, new diabetes plus weight loss, new diabetes plus abdominal or back pain, new diabetes plus appetite loss or stool changes. This is the symptom many families miss. They focus only on sugar levels, but sometimes the deeper question is, why did the blood sugar change now? If you are older and recently diagnosed with diabetes, especially with unexplained weight loss, ask your doctor whether the pancreas needs evaluation. Number 9. Unusual fatigue and weakness. The ninth warning sign is deep fatigue, not normal tiredness, not "I had a busy day" tiredness. I mean a heavy tiredness that does not improve with rest. Pancreatic cancer can create fatigue through poor digestion, inflammation, weight loss, anemia, poor appetite, sleep disruption, or metabolic changes. A senior may stop walking as much. They may nap more. They may lose interest in daily activities. They may feel weak after small tasks. They may look drained. Fatigue alone is common and can come from many causes. But fatigue with weight loss, jaundice, pain, or appetite loss should not be ignored. Your energy is a health signal. When it drops suddenly and stays low, find out why. Number 10. Itchy skin without a rash. The 10th symptom is itching. This surprises many people. When bile flow is blocked, bile salts can build up in the body and cause itching. The skin may itch even without a clear rash. The itching may be worse at night. It may affect the arms, legs, back, or whole body. People may scratch until the skin becomes irritated. If itching happens with yellow eyes, dark urine, or pale stool, it becomes much more concerning. Itching can come from allergies, dry skin, kidney disease, liver disease, medications, or many other causes. But itching plus jaundice symptoms needs medical attention. Number 11. Blood clots or swelling in one leg. Another lesser-known warning sign is a blood clot. Pancreatic cancer can increase the risk of blood clots in some people. Signs of a clot may include swelling in one leg, pain in the calf, redness, warmth, sudden shortness of breath, chest pain. A blood clot can be dangerous and needs urgent care. Most blood clots are not caused by pancreatic cancer, but an unexplained clot, especially with weight loss or abdominal symptoms, should make doctors look carefully for underlying causes. If one leg suddenly swells or becomes painful, do not wait. Number 12. Depression or sudden mood change. This one is more subtle. Some people with pancreatic cancer report mood changes, depression, anxiety, or a sense that something is wrong before diagnosis. This does not mean depression equals cancer. Depression is common and has many causes. But sudden mood change in an older adult, especially with weight loss, appetite loss, fatigue, or digestive symptoms, should be taken seriously. The body and brain are connected. Sometimes illness changes mood before the diagnosis is obvious. Who is at higher risk? Now let's talk about risk factors. Pancreatic cancer risk increases with age. Most cases occur in older adults. Risk may also be higher with smoking, long-standing diabetes, chronic pancreatitis, obesity, family history of pancreatic cancer, certain inherited genetic conditions, heavy alcohol use through pancreatitis risk, a history of pancreatic cysts in some cases. Having a risk factor does not mean you will get pancreatic cancer. Having no risk factor does not mean you cannot get it. But if you are older and have risk factors, persistent symptoms deserve faster attention. When should you call a doctor? Call your doctor soon if you have yellow eyes or skin, dark urine with pale stool, unexplained weight loss, upper belly pain going to the back, oily floating stool, persistent nausea or appetite loss, new diabetes after 50 or 60 with weight loss, blood sugar suddenly becoming difficult to control, a blood clot with no clear cause. Seek urgent help if you have severe abdominal pain, severe vomiting, confusion, chest pain, shortness of breath, or signs of a blood clot. Do not self-diagnose, but do not dismiss warning signs either. What tests might a doctor use? If pancreatic cancer is suspected, doctors may order blood tests, liver tests, imaging, CT scan, MRI, ultrasound, endoscopic ultrasound, or other investigations. A blood marker called CA19-9 may be used in some cases, but it is not a simple screening test for everyone and can be abnormal for other reasons too. The main point is this: symptoms guide evaluation. You do not need to know which test to demand. You need to clearly describe your symptoms and timeline. Tell your doctor when it started, what changed, how much weight you lost, whether your eyes look yellow, what your stool and urine look like, whether pain goes to the back, whether diabetes is new or suddenly worse. The clearer your story, the easier it is for your doctor to act. The 3-week rule for seniors here is a simple rule. If a new digestive symptom lasts more than 2 to 3 weeks, gets worse, or comes with weight loss, jaundice, dark urine, pale stool, or back pain, do not ignore it. Do not keep treating it as gas forever. Do not keep changing antacids forever. Do not blame every symptom on age. A symptom that persists deserves investigation. Final message. Pancreatic cancer is serious because it often hides behind ordinary symptoms: indigestion, back pain, loss of appetite, weight loss, fatigue, new diabetes, oily stool, dark urine, yellow eyes. These symptoms do not always mean cancer. Most of the time, they may come from other conditions. But when they persist, appear together, or happen in an older adult, they should not be ignored. Your body may whisper before it screams. Listen early. If this video helped you, comment below. Which symptom do you think people ignore the most? Back pain, weight loss, indigestion, stool changes, or new diabetes? And share this video with someone over 60. Awareness does not create fear. Awareness gives people a chance to act sooner.